Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Can you tell me more about what's been going on?
Good morning, doctor. Yes, it's been quite distressing actually. I've been having this persistent bad breath. It's like nothing I do seems to make it better. I brush and floss, use mouthwash, and even chew gum constantly, but within an hour or so, that horrible smell comes back. It's strong enough that people around me notice, and it's embarrassing.
I see. That does sound frustrating. How long has this been going on?
I'd say it's been about 5 or 6 months now. Initially, I thought it was just a dental issue, so I went to my dentist. They gave me a thorough cleaning and even looked at my gums, but there was nothing significantly wrong. They said my gums were a bit inflamed, but nothing severe. They recommended some stronger mouthwash, but it barely made a difference.
All right, and apart from that, do you have any other symptoms?
Yes, there's a bit of that actually. My mouth does feel dry at times, and I also have this unpleasant taste that seems to linger, especially in the morning. I wake up with my mouth feeling almost stale. And, I don't know if this is related, but I sometimes feel like I have a coating on my tongue. It's not always visible, but it just feels like there's something there.
Mihiraa, have you tried anything else to address the issue?
Oh yes. I tried changing my diet because someone suggested it might be related to what I eat. I cut down on coffee, stopped eating garlic and onions entirely, and even reduced my sugar intake, thinking maybe it was feeding bacteria. I also started drinking more water. But even with all those changes, the bad breath has remained just as intense.
I appreciate you sharing those details. It sounds like you've made quite an effort. Let's go over your routine and see if there's anything else that might be contributing. Could you describe your daily habits?
Certainly. I wake up around 6:30 a.m., brush my teeth, and have a light breakfast, usually some toast or cereal. I do drink a small cup of coffee, and I try to drink water throughout the day, though I admit I sometimes forget. I work at a desk job, so I don't move around much. I tend to snack a bit, maybe on fruits or crackers. By evening, I have a simple dinner, no spicy or overly seasoned food anymore. I brush again before bed and use mouthwash, but as I mentioned, the odor is back by morning.
Thanks, Mihiraa, that's helpful. Do you have any underlying health conditions? Or are you currently on any medications?
Yes, I have mild acid reflux, and I take omeprazole for that every morning. It helps, but I do notice some stomach discomfort occasionally, especially if I skip a dose. I also have mild seasonal allergies, and I take an antihistamine as needed. Nothing else, though. I haven't been on any antibiotics recently or anything like that.
Mihiraa, acid reflux could indeed be a factor, especially if it's causing something called gastroesophageal reflux, which can lead to halitosis by allowing stomach acids and partially digested food to move up into the esophagus. Omeprazole might control the acid production, but it doesn't stop the physical reflux. And sometimes, even a mild reflux issue can cause chronic bad breath.
I see. That's interesting. I hadn't thought about the acid reflux contributing to this. I mean, I always thought of it as more of a stomach issue, you know?
Understandable, Mihiraa. I'll provide you with some alternatives to try. Drinking water regularly will help with dry mouth, And there are also lozenges that stimulate saliva production. I can suggest a prescription-strength mouthwash with chlorhexidine as well. It might help until we get to the root cause. Also, avoiding late meals might reduce reflux during the night.
Thank you, doctor.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Nurse Collins Liston. Could you tell me a bit about what you've been experiencing?
Yes, thank you, Nurse Liston. I've been having this persistent irritation in my eyes. It started gradually, but now it feels like it's there almost constantly, especially during and after work.
I see. Could you describe the irritation in more detail?
It's a combination of things, really. I get this dry, gritty feeling like there's sand in my eyes. It's especially noticeable after I've been staring at my computer screen for a while. By the end of the day, my eyes are sore, and sometimes I even get headaches. The burning is intense, my eyes often look red and feel tired.
That sounds uncomfortable. Mihiraa, how long have these symptoms been going on, and have you noticed any patterns or triggers?
It's been a couple of months now. I notice it's worse on days when I have back-to-back analysis tasks, which means I'm pretty much looking at the screen for hours without much of a break as I am a data analyst, so I'm constantly going through spreadsheets and coding scripts. I know the screen time might be contributing, but it's hard to avoid.
I understand. Screen time is a common culprit for eye irritation. Have you tried any remedies or adjustments to alleviate the symptoms, Mihiraa?
Yes, I've tried a few things. I read about the 20-20-20 rule, so every 20 minutes, I look away from the screen for about 20 seconds, focusing on something at least 20 feet away. It helps a little, but only temporarily. I've also used some over-the-counter lubricating eye drops, but they don't seem to provide lasting relief.
The 20-20-20 rule is indeed a good approach. It can prevent excessive strain by allowing your eye muscles to relax regularly. Have you incorporated any other eye exercises or changes to your work environment, like adjusting lighting or using a screen filter?
Not really, apart from dimming my screen brightness a bit. I haven't tried filters, but I can look into that.
Based on what you've described, Mihiraa, it sounds like you may be experiencing asthenopia. It is particularly common in people who spend long hours on screens, as the intense focus can fatigue your eye muscles and irritate the ocular surface.
That makes sense. Is it serious?
It's usually not serious, but it can certainly impact your quality of life and concentration. Left untreated, it can lead to more persistent discomfort, so it's important to manage it with effective strategies. Let's go over a few steps to help manage your symptoms. I recommend sticking with the 20-20-20 rule, as it's a proven method. Additionally, incorporating palming exercises, where you rub your hands together to create warmth and then gently cup them over your closed eyes, can be soothing and help relax the eye muscles, Mihiraa.
All right, I'll try that. Is there anything I should do in terms of medication?
Yes, for more immediate relief, I'd suggest continuing with the eye drops, but make sure they're preservative-free to avoid potential irritation with long-term use. If dryness continues, we could consider artificial tears that mimic the natural tears more closely. Mihiraa, though rare, prolonged eye strain can contribute to chronic dry eye syndrome. So, catching it early and implementing these strategies will help prevent that.
I'll definitely try all of these. Thank you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a GP called Mihiraa talking to a duty doctor. Now read the question.
Dr. Hudson, I'm concerned about Mr. Larry's condition. He's been admitted with acute chest pain and shortness of breath.
Thank you for the update, Dr. Mihiraa. Can you provide more details about his medical history?
He has a history of hypertension and hyperlipidemia. He's also a smoker.
Does he have any family history of heart disease?
Yes, his father passed away from a heart attack at a young age.
We need to consider the possibility of a heart attack or angina. Let's order an electrocardiogram and cardiac enzymes to assess his cardiac status.
I've already ordered those tests. We'll also need to monitor his vital signs closely and administer oxygen therapy.
Good, Dr. Mihiraa. We should also consider administering aspirin to prevent blood clot formation.
I'll discuss the treatment plan with Mr. Larry and his family. It's important to keep them informed about his condition and the steps we're taking.
Now look at question 26. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Larry, I'm going to change your 4-fluid bag now. This is a routine procedure to ensure you receive continuous medication and fluids.
Okay, Mihiraa. Does it hurt?
The procedure itself is usually painless. You might feel a slight pinch when I insert the new needle.
Will it take long?
The process should be quick. I'll adjust the flow rate to ensure you receive the correct amount of fluids.
What if I feel any discomfort after the 4 change?
If you experience any pain, redness, or swelling at the 4 site, please let me know immediately. We can adjust the 4 or apply a warm compress to alleviate any discomfort.
Okay, Mihiraa. Thank you.
Now look at question 27. You hear a doctor called Mihiraa talking to a neurologist. Now read the question.
Dr. Hudson, I'm referring Mr. Larry to your neurology clinic for further evaluation. He's been experiencing persistent headaches and cognitive decline.
Thank you for the referral, Dr. Mihiraa. I'll schedule an appointment for Mr. Larry. Could you provide me with more details about his symptoms?
He's been complaining of headaches that are often accompanied by nausea and vomiting. He's also having difficulty concentrating and remembering things.
Has he noticed any changes in his vision or speech?
Not that he's reported, but we should rule out any neurological disorders that might be causing his symptoms.
I'll perform a thorough neurological examination, including cognitive tests and imaging studies. We may also need to consult with other specialists, such as a neuropsychologist or neuro-ophthalmologist, depending on the findings, Dr. Mihiraa.
Thank you. I appreciate your expertise in diagnosing and managing complex neurological conditions. I look forward to discussing Mr. Larry's case with you further.
Now look at question 28. You hear a doctor called Mihiraa talking to a hospital manager. Now read the question.
Mr. Hudson, I'm writing to express my concern about the state of our current medical equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Dr. Mihiraa. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inaccurate diagnoses, delayed treatments, and increased patient risk. It's essential to invest in modern technology to provide optimal patient care.
I agree, Dr. Mihiraa. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should also prioritize the most critical equipment needs, such as those used in emergency situations or for complex procedures.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient safety and ensure that we have the necessary resources to provide quality care.
Now look at question 29. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Hudson, I'm concerned about the recent changes in our duty hours. The increased workload is affecting our ability to provide quality patient care.
I understand your concern, Mihiraa. The new schedule was implemented to optimize staffing and improve efficiency. However, I recognize that it may be challenging for some staff members.
The longer shifts and irregular hours are taking a toll on our physical and mental well-being. We're struggling to balance our work and personal lives.
I agree that the new schedule can be demanding. We need to find a balance between meeting the needs of our patients and ensuring the well-being of our staff.
Perhaps we could consider alternative scheduling options, such as compressed workweeks or flexible shifts. This could help reduce burnout and improve job satisfaction.
That's a good suggestion, Mihiraa. We'll explore different options and seek input from the staff to find a solution that works for everyone.
Now look at question 30. You hear a head nurse called Mihiraa talking to a junior nurse. Now read the question. Nurse Hudson, I've noticed some inconsistencies in your documentation. It's crucial to maintain accurate and detailed records.
I apologize, Mihiraa. I'll be more careful in the future.
It's not just about avoiding errors. Accurate documentation is essential for patient safety and legal compliance. It helps us track progress, identify trends, and make informed decisions about patient care.
I understand. How can I improve my documentation skills?
Pay attention to detail and use clear and concise language. Avoid using abbreviations and jargon that may be misinterpreted. Document promptly after each patient interaction to ensure accuracy.
What about subjective information, Mihiraa, like a patient's pain level or mood?
Document subjective information objectively. Instead of writing, "patient is in pain," describe the intensity of the pain using a pain scale. This will help us track changes over time and make informed decisions about pain management.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an oncologist, Dr. Mihiraa, and an interviewer. Dr. Mihiraa, thank you for joining us to discuss the concerning increase in breast cancer cases. To begin, could you share the latest findings on this issue?
Certainly, it's a crucial topic. The latest report from the World Health Organization highlights a steady increase in breast cancer cases worldwide, surpassing previous projections. Specifically, global statistics show that breast cancer has now become the most commonly diagnosed cancer, even overtaking lung cancer. Notably, the data highlights a rapid rise in both developed and developing countries, but there are some unique variances by region. This report indicates not only a rise in cases, but also reveals disparities in diagnosis stages, which is especially worrisome. Advanced diagnoses are more common in regions where awareness and early screening are limited. In essence, this report calls attention to breast cancer's shifting demographics, hinting at lifestyle and environmental factors that might be driving this trend.
That's quite concerning, Dr. Mihiraa. What does this rise in numbers signify in the broader context of healthcare?
In the bigger picture, these statistics are a wake-up call for the healthcare system. They highlight a potential shift in health priorities as we see cancer incidences grow in unexpected demographics and age groups. Where we once saw breast cancer primarily in older populations, it's now appearing more frequently among younger women, suggesting that lifestyle and genetic predispositions are evolving factors. Moreover, it suggests a stronger urgency for a multi-tiered approach to healthcare that goes beyond treatment to emphasize prevention and early diagnosis. As more people are affected across diverse socioeconomic backgrounds, it's becoming apparent that healthcare systems worldwide must adopt comprehensive, resource-sensitive cancer policies. In essence, the report underscores a changing dynamic that no longer allows us to approach breast cancer in a traditional way. It's a sign that prevention and early detection need to be at the heart of our efforts, along with understanding why these rates are rising.
You mentioned younger women being affected more frequently. Who, then, is most at risk with this rising trend, Dr. Mihiraa?
Yes, while traditionally, breast cancer has been more common among women above 50, we're observing an increasing rate in younger women, specifically those in their 30s and 40s. Additionally, certain racial and ethnic groups have shown varying risk patterns. For example, African American women, although less frequently diagnosed, often face more aggressive forms of the disease. This variation in risk factors can be attributed to multiple elements, ranging from genetic predispositions to lifestyle factors like diet, alcohol consumption, and environmental exposure. The data suggests that younger women, particularly those with family histories of breast cancer, or those in urban environments with high stress levels and limited access to preventative care, are becoming a newly vulnerable group. Essentially, the demographic impacted most by these rising rates is shifting, challenging the notion that breast cancer is predominantly an older woman's disease.
Given this change in demographics, Dr. Mihiraa, what do you believe should be done to address the rise in breast cancer cases effectively?
It's imperative that we adopt a multifaceted approach. Firstly, increasing public awareness about breast health and promoting regular self-examinations could make a tremendous difference in early detection. Screening programs need to be not only widespread, but also accessible, especially in underserved communities. This accessibility is crucial because a large percentage of patients, particularly those from lower socioeconomic backgrounds, often lack the means to pursue regular screenings. Additionally, implementing educational campaigns in schools and workplaces to destigmatize breast health conversations could encourage earlier action. Beyond awareness, there is a pressing need for healthcare infrastructure improvements. Clinics and primary care facilities must be equipped with diagnostic tools and staffed with professionals who are trained to recognize early symptoms. On a broader scale, healthcare systems need to offer better support for genetic testing in high-risk populations, as genetic mutations like BRCA1 and BRCA2 significantly increase breast cancer risk. Addressing these issues would bring us closer to a more proactive stance on breast cancer rather than a reactive one.
With such comprehensive steps needed, are there any significant advancements in treatment that could help manage or even reduce breast cancer mortality?
Thankfully, we've seen promising advancements in recent years. For one, targeted therapies have become game changers, offering treatment options that are more effective and less invasive. Drugs like HER2 inhibitors and CDK4/6 inhibitors have shown great promise in managing breast cancers that were once more challenging to treat. Additionally, immunotherapy has introduced a new dimension, enabling the body's own immune system to identify and attack cancer cells more effectively. Another advancement is personalized medicine, where treatments are tailored according to the individual's genetic makeup. This precision medicine approach minimizes the side effects and enhances the efficacy of treatments. Lastly, the use of artificial intelligence in diagnostics allows for earlier detection and even predicts the likelihood of recurrence, which can be pivotal in treatment planning. Collectively, these advancements suggest that while breast cancer cases may be on the rise, our ability to treat and manage the disease is evolving rapidly as well.
It's reassuring to hear about these advancements. What does the future look like for breast cancer treatment and prevention?
The future, while challenging, holds a great deal of promise. We are moving towards an era where breast cancer may be detected even before physical symptoms manifest, thanks to advancements in genetic screening and predictive analytics. Precision medicine and machine learning technologies are poised to revolutionize not just treatment, but early intervention. There is also growing research in epigenetics, which studies how lifestyle and environment impact gene expression, providing insights into prevention strategies. However, these scientific advancements alone won't suffice. A critical component of the future will be ensuring these innovations are accessible globally, not just in developed regions. Ideally, breast cancer care will become more integrative, blending technology, personalized care, and community health initiatives. With continued research, we may see a future where breast cancer, even if diagnosed, doesn't carry the burden it does today.
Now look at Extract 2. Questions 37 to 42. You hear Dr. Larry Game on hair fall research at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. I am Dr. Larry Game, and today I have the pleasure of sharing insights from our latest research at Mihiraa Care, a division of the Mihiraa Healthcare Institute, focused on one of the most complex and prevalent issues in dermatology and general health, hair fall. Over recent years, Mihiraa Care has expanded its research efforts to address the intricate biological, genetic, and environmental causes of hair loss, identifying promising avenues for both prevention and treatment. The comprehensive research at Mihiraa Care isn't just about understanding hair fall superficially. Instead, we're striving to map its core mechanisms, seeking to provide solutions grounded in advanced scientific understanding, with a deep look at the systemic factors impacting hair health. Our current research at Mihiraa Care is dedicated to examining the multifaceted pathways involved in hair fall. Hair loss, which may seem simple on the surface, is actually driven by a convergence of biochemical, hormonal, and environmental factors. Mihiraa Care's approach is to integrate these multiple dimensions by focusing on how genetic predispositions interact with lifestyle factors like stress, diet, and pollution exposure. Unlike traditional studies that might concentrate solely on one factor, say, genetics or hormonal imbalance, our research takes a systems biology approach to uncover the interplay of different causes. Our studies have unveiled that hair follicles experience cyclical growth influenced by a blend of cellular signals, nutrient availability, and immune responses. This cyclicality is interrupted when one or more of these factors are compromised. Thus, at Mihiraa Care, we're developing what we term a holistic model of hair health, involving micro-level nutrient analysis, genomic sequencing, and molecular signaling studies. This holistic approach is designed to address hair loss from multiple angles, aiming to facilitate personalized treatment solutions for patients. The significance of Mihiraa Care's hair fall research lies in its potential to redefine conventional wisdom surrounding hair loss treatment. Rather than viewing hair loss as a standalone issue, our findings reveal it as an early indicator of deeper physiological imbalances. By understanding hair fall as a symptom of systemic dysregulation, we position it within a broader health framework. This redefinition has substantial implications for both treatment approaches and patient care. At Mihiraa Care, we have seen patterns that suggest a correlation between hair health and immune system functionality. For example, chronic inflammation, often a silent condition, may progressively impair the health of hair follicles. This research is groundbreaking because it introduces the notion that treating underlying immune issues, nutritional deficiencies, and even stress responses could yield significant improvements in hair regrowth and resilience. The ultimate aim of Mihiraa Care's research is to create targeted therapies that don't just mask hair loss, but address its foundational causes. The challenge in developing effective hair fall solutions is the heterogeneity of factors involved. At Mihiraa Care, we are aware that hair fall varies widely from individual to individual, influenced by a spectrum of genetic, lifestyle, and environmental elements. Another pressing issue is the high recurrence rate of hair fall in patients, even after seemingly successful treatments. This recurrence, we believe, is due to therapies that address the visible symptoms without resolving underlying triggers. Furthermore, the precision of diagnostic tools in hair fall treatment remains limited. Most assessments rely heavily on visual examination and patient history, which can miss the subtle biochemical markers detectable only through advanced lab analyses. Mihiraa Care's research seeks to overcome these limitations by developing precision diagnostic protocols that can identify these biomarkers and track them over time. These methods will enhance the predictability and sustainability of treatment outcomes. Looking forward, Mihiraa Care is committed to enhancing the personalization and effectiveness of hair loss treatments by integrating predictive analytics, AI-based genomic profiling, and nutrient-specific interventions. The goal is not only to treat, but also to prevent hair fall by understanding the predictive factors and early warning signs of hair health deterioration. Another area Mihiraa Care intends to explore is the impact of personalized nutrition on hair health, which is often overlooked in conventional dermatology. Given that hair is a protein filament, its health can be profoundly affected by micronutrient availability and metabolic efficiency. Our future work will investigate how tailored dietary plans can maintain hair follicle integrity and reduce the risk of hair loss. Ultimately, Mihiraa Care envisions a future where patients receive precise, data-backed treatments that cater specifically to their unique biological profiles. Turning our findings into practical solutions involves a multi-tier approach. Mihiraa Care aims to partner with technology firms to develop diagnostic devices that patients can use at home, allowing real-time monitoring of their hair health indicators. This accessibility would empower patients to be proactive in managing their hair health, reducing the burden on clinical resources and allowing practitioners to focus on advanced cases requiring intensive interventions. We are also in the process of designing clinical trials that will evaluate various treatment regimens tailored to specific hair loss causes. Mihiraa Care's goal is to identify the optimal combinations of dietary supplements, topical treatments, and lifestyle modifications for each identified hair loss pattern. This evidence-based approach ensures that treatments are effective, safe, and suitable for long-term use. As we advance, Mihiraa Care's central focus remains on developing and validating therapeutic methods that blend science with a patient-centered approach. Our research roadmap includes ongoing studies to determine the effects of mental health, particularly chronic stress, on hair loss patterns. Stress has been shown to disrupt normal hormonal rhythms, which in turn impacts the hair growth cycle, leading to an increase in hair fall rates. Finally, Mihiraa Care aspires to educate and collaborate with patients, enabling them to participate actively in their care journey. Through workshops, educational resources, and a dedicated support network, we aim to equip our patients with knowledge and tools to maintain their hair health proactively. Our mission at Mihiraa Care is not just to treat symptoms, but to pioneer a lasting change in how hair health is approached and managed.
That is the end of your OET listening test. Now check the answers.